I'm with all those different letters.
Hello and welcome everyone. We are excited to have you all in the workshop today with Karen Friedman. The workshop today is engaging all abilities during COVID-19, and Karen Friedman is the national manager at YMCA for abilities, and we are super excited to have you and Karen all here today. So without further ado, Karen, all yours. Wait, before I go there, I'm gonna ask everyone if we can all turn off our videos. That helps save internet and data plans for everyone, especially those of us who are sharing the internet with other family members. I know you all know what's that about. We also ask you if you can change your name to your name and your city or your YMCA. And if you want, you can also add your pronouns. That will help us also when we have a dialogue during the conversation today. We are recording the session. We are also live streaming on YouTube, so people who want to watch it can, and we will also be able to post it later on link for colleagues who are busy now and cannot join right now. Why? We will be muting everyone during the presentation so we can ensure everyone can hear, and then when we have dialogue, we will ask you to unmute yourself, or we can help you with that so we can have questions, answers, and dialogue with our speakers. So without further ado, I think I covered all the logistics. I'll give it back to you, Karen.
It depends on the task you're doing. Great. Thank you so much, Renata, and welcome everyone. Really excited to be here. I see a lot of familiar faces. This is such a wonderful week to get together and see people. Some of you I've met, others are new, so thank you again for joining our session today. We are excited to start off this week to move forward to talk really about how are we going to begin impacting and changing the systems to create real change within our communities. And today's conversation is entitled Engaging All Abilities, and beginning to look at an opportunity for us to have a conversation today. Today is really about talking. We have some people who have stepped up who are going to share what they've been doing during these times, and then also want to open it up to have a conversation around how are we positioned as the Y to ensure that we are engaging all communities, including those communities of disabilities. And also, how can we move forward to ensure that these communities are still served and welcome and included at the YMCA? So my name is Karen Friedman. I am the manager of Access and Ability at YUSA. I am on the DIG MD team. You've probably heard that phrase already a couple times this week. It's our Diversity, Inclusion, Global, and Multicultural Development team. We are excited you're here with our virtual experience this week. I'm going to go ahead. Hopefully you can see my slides. And we're going to go through. So quickly, for today's conversation, we just wanted to start off with some high level talking about the state of disability during COVID. Then we'll hear from some local YMCA leaders and how they've been navigating and experiencing this time. We will open it up for some questions and answers. So while we're hearing from local Ys, if you do have a question, you can put it in the chat and we'll answer those after we hear from our presenters or those answering what they've been doing. And then moving forward, begin talking about how do we continue to connect, network, and organize to support our communities as we look, in the next, throughout the, 2020 and then into the future, into 2021. So again, we did just want to highlight, this conversation today, we're focusing and talking about, ensuring that we are inclusive of all dimensions of diversity, including ability and mental health. And this is core, to our strengthening communities for all. As we have this conversation today, right, we want to recognize, number one, that communities, those who identify as having disabilities or those who identify as having mental health needs, right, these are communities that we're here to support and engage, but also recognize that there's a lot of intersectionality that happens within these communities, that many individuals are impacted differently, whether that's based upon their gender and their disability, based upon their race and how they identify, based upon their ethnicity and disability. So while we are going to focus in on really looking at ability, really looking at mental health, mental wellness today, just want to ensure we continue to have that lens of intersectionality, understanding that individuals are not seen through just one dimension, but that also that when we understand and look at equity and begin to look through this lens of equity, that we are not in competition, but this is a way that we can strengthen our organization to ensure all communities are included and that we are working together to ensure that this is a place and a space that we are keeping individuals with disabilities and their families in our, our foremind is the word I don't think that's a word, right? Keep them, ensuring we're keeping them at the forefront. There we go, at the forefront as we're continuing through this, because as we begin to look at and understand what's happened uniquely during this time of COVID since March in this space that we are in, right, that Americans with disabilities, and I just pulled a couple quotes and pieces that were coming up, are largely left out of the US coronavirus response despite being uniquely affected by the disease. Right, so we know traditionally, right, a lot of people with disabilities are left out of disaster response and disaster preparedness. And this has had an impact, right? We've seen real consequences in what's happening in our communities today. In addition, the pandemic has caused many providers to suspend certain services, including those that specifically benefit individuals with disabilities. And want to hear too how your whys are, how does that impact your whys? What are you hearing from your families? What are you hearing from individuals? Right, as many of their support services have been uniquely impacted, whether that's no longer being available, whether now that in terms of services that do need to be in person, not available or switching to virtual, how is that impacting those individuals? We also know that there is a unique overlap too in understanding around mental health and those who identify as having another disability, that sometimes, right, mental health, your mental wellness can be impacted if you do have a disability, plus the onset of the pandemic, and also understanding the current civil unrest across the country, right? These pieces are impacting especially communities, our disability communities in unique ways. And then, in just looking at one piece, we've seen many different statistics pieces coming out. There was a letter written recently talking about, how the pandemic has taken a disproportionate toll on people with intellectual and developmental disabilities. And while we state this, and as we're looking at some of the data and how COVID-19 has really impacted the disability community, right, we're really want to ensure that, and important to note, that we're not conflating health status with disability. Right, many people with disabilities are healthy, right? This doesn't mean that they're not healthy, but many of their unique needs as a community, right, which is a very diverse community in terms of many different types of disabilities, have been impacted disproportionately based upon this. When we think about disabilities, we think about individuals who have limits on their ability to participate. They can range from motor disabilities to sensory deprivation to intellectual and developmental disabilities. Right, in short, disability encompasses a huge array and variety of conditions and limitations on an individual's access and experience of our society. And it's not necessarily the same, right? That experience is not necessarily the same across all disabilities. So I want to recognize that this is a very diverse group, but they have are facing some similar barriers, and also have experienced some success as well during this time and opportunity in how we view disability and support disability. So just like to start off with that. Some big places we've seen some barriers for individuals has been in communication. How are we communicating, number one, from a larger global lens of the pandemic and supports and resources and things we need, but also as a YMCA, how is our communication getting out to those communities? Is it accessible? Are people able to access it, understand it, and utilize it? In terms of public health strategies, how are we keeping people with disabilities at the forefront of those pieces? Is everything we're talking about accessible? Are we bringing that into light, from simple as, when we are talking so much about hand washing? Do we have accessible facilities? Do people with disabilities have accessible facilities to wash their hands? Do they have the proper training capacity to do that, just in those pieces? And then equitable access to healthcare is a huge need within this, for many people with disabilities. Is, are they able to provide providers? Are providers able to communicate with them, give them the information they need? And many people with disabilities do have underlying health conditions. So during this time, how are they accessing services? What anxiety do they have about accessing services, whether that is accessing services, or whether that is ensuring that they are accessing PPE, getting equipment that they typically need and have used for a long time, they may be in shortages. So overall, these are just a couple things that we wanted to start off by and beginning to provide some context as we talk through this and how YMCAs are beginning to address some of these needs. We recognize, right, in talking to a number of YMCAs, I sit at YUSA on the DIG-MD team, and when, as sitting there and looking and talking across the United States, we really saw as YMCAs with their communities began to shut down, a lot of any programs or services or events that specifically targeted people with disabilities were some of the first to shut down in response to that community's need and real concern to ensure that this vulnerable population was closed. But as these programs shut down, we're also finding some of them are a little bit harder to start up. And if that is the wise need, how can we begin to work together to talk through some ways, some strategies on how we ensure these communities' needs are still being met? We recognize too that many YMCAs, this is still a priority, want to ensure that they are inclusive and equitable for all. And this is a space we want to create to talk through the barriers we're hitting and not talk, this is not about saying the intent's not there, but that there are real barriers, there are real financial limitations that we're all facing. So how do we create a space to do that and talk through those pieces? So I've had a number of conversations over the past couple months now with a number of YMCAs who have shared what they're doing and shared some of their challenges and some of the successes they've had. And we wanted to create a space today to highlight some of those, to have some individuals talk about what they've been doing. And then from there, we invite, if there's anyone else that would like to share what they're doing, please go ahead and do that. And then open up a question and answer and use this opportunity today as a stepping off point to continue to organize a network that can continue to have these conversations and support our disability community, our communities of diverse abilities, and in addition to those individuals who have a disability due to poor mental health or due to a mental illness. How does this space continue to thrive? How does this space continue to move forward? So with that, I'm going to continue on, and I'm actually going to invite Sarah HENESEY from the HOCKOMOCK area YMCA, well, my former YMCA, and I'm going to invite Sarah. And Sarah, I'm going to go ahead and spotlight you, and I have pulled, my screen just went dark, but I sent you a couple questions, but really, number one, want to start off, and with all our panelists, is first of all, just want to ask you, how are you doing, right? How are you doing? How have you been managing this time? Because what we've recognized, and I think many of us has known for quite a while, is that our mental health, right, is important as staff, as providers, as community members, as family members, right? So how are you doing and how have you been taking care of your mental health? I really want to ensure that we're creating a culture in which we're checking in on one another. And so how do we create that? So Sarah, go ahead, introduce yourself and, how are you doing?
Hi, Karen. Thank you for having me. As Karen said, I'm Sarah HENESEY. I'm the Senior Director for Inclusion and Diversity at the HOCKOMOCK area YMCA in Massachusetts. And I think I'm okay, right? Some days I have really good days, and some days I feel the pressure of what we're doing and being able to provide a quality service more so than others. I will say I am deeply blessed to have a team that has remained committed and positive and supportive of each other in our mission of doing this. And I don't think I could be doing what I'm doing without having that support from the professionals and colleagues that I work with, specifically in our integration initiative, but in our Y as a whole. I'm quite blessed, as I said, to have that opportunity. And, on a personal note, my husband has been at home through all of this. And so I feel like I've got some balance of support and camaraderie and the sounding board of, but we try it this other way, or here's this other idea or other approach. And working out, my husband wanted a Peloton and it's really expensive. And I thought, do we really need it? And I'm really glad I let him talk us into that, because that's a huge part of my mental health, is being able to burn off all of that extra stress and energy in a constructive way. And the fact that we already had it before our state quarantine began was huge for us. So I'd like to start there. And Karen, would you like me to move to the second question as well, or?
Sure thing. Yeah. That sounds great. And just for others too, you mentioned the integration initiative. So, just ensuring you talk a little bit about what that is and, how's your current state? What are you doing currently? And thank you for sharing. I think we were just talking earlier, YMCA spouses and partners do not always get the accolades that they need for the support they provide. So thank you for that shout out. So.
Absolutely. Yes. So the YMCA, the HOCKOMOCK area YMCA has what we call our integration initiative. And so with it not being a program in the same way that we think about athletics or sports or childcare, it's this initiative that is embedded in all of the ways in which we support our members of all ages who with disabilities or special needs be able to access all of the programming and features of our YMCA community through group fitness and youth programming, accessing our wellness center. So we support on those levels, as well as running specialized programs for specialized group fitness or access to Special Olympics for our teens and young adults, and social and community outreach programs for our older participants as well. And we are also supporting our young learners with special needs and special accommodations that are required through IEPs in our out of school and remote learning programs. Through our integration initiative, we run special events, including dances and parties and recreational sports and athletic skill building programs, and our golf team, as well as the other sports teams that we run. And we also have a really nice relationship with our local community for schools and residential settings. So our community members with special needs have a pathway that is supported to come into our YMCA and access their own health and wellness in that regard. So looking at what we do, we needed to pivot really rapidly to finding a way to provide some stability and consistency and a little bit of that mental health support for all of our participants, largely in our teen and young adult population, where we have a very tight-knit group of young men and women who come to the YMCA for their wellness choice, but also for the friendship and the social engagement that our Y provides. And our families have, the families of those individuals have become a family group of their own. And so we needed to find a way to ensure that those individuals who, as Karen was mentioning, I mean, we know that they are uniquely vulnerable to our health crisis as with regard to their own physical health, but also their own mental health, compounded by what we know about the risks to this population from a physical health and wellness perspective for long-term wellness for our individuals with disabilities. And so we started just sort of on a social level, Zoom, get out there, make sure they have a place to come together and have something that feels typical, have a way to connect with these people that are so important to them, and have something that just is stable. And then moved from that to structured programming pretty quickly after we established that foundation of we're still here and the Y is still here for you. And then as our reopening progressed, we were able to move into live programming in an outdoor arena and finding ways to be very creative and being able to adapt rapidly as our reopening phases progressed. So what is it safe to do now? So instead of getting stuck at this is where we think people might be comfortable, but okay, how can we show to our families and our participants we can do this safely and continue to promote health and welfare for those participants?
Great, thank you so much, Sarah. So it really sounds like you have the integration initiative, you have some established programs and spaces, and that you were able to transition those to virtual spaces, which is, I think, great. And then really listening to your families, that a lot of them, right, were there for social, right? The social experience was why they were coming to the Y, right? For community, that sense of belonging that we all have. And it does sound like too that once families kind of understood the safety, that they were willing to come back and wanted to come back again and participate. Is that what you found overall?
Largely. I think most families were quite eager, right, to have an opportunity to show their young adult it is safe to go out when it's done properly, and you can see your friends and you can do these things that are so important to you, whether it's golf or whether it's bocce or whether it's soccer or whether it's basketball. And we were very stringent in the way we managed our supplies and our wellness checks before they even were allowed on to the field and all of those things. So a new routine was established that, so I hate to use the expression, but that new normal, right? But to create that foundation of, okay, this is what it takes and this is what it should feel like each and every time, but also to provide these young adults some skills of their own of this is how you can manage when you're out in public and it's okay, and have some sense of self-control over that as well.
Yeah. And so my next question is kind of looking forward, right? What are there challenges that you anticipate, or looking forward, and as we move forward, or do you foresee any challenges coming ahead?
I do, actually, because being in New England and the weather is changing, we've been very fortunate. Our summer was quite nice. And so we were able to do all of our programming outside with very few canceled due to rain or inclement weather, very few canceled sessions. But we are now entering that stage of the year where that's not as viable. And with what's happening with the COVID spike, really trying to balance, can we continue to, and when I say can we, is it even possible, as the state is, looking at what phase of reopening are we at, and what are the safe venues and the safe activity levels, and figuring out ourselves, how do we navigate that, and then doing it in a way where the families continue to feel confident and safe in having their young adults participate, and having the young adults feel like this is something that still feels good because it has felt good all summer. And how do we bridge that gap in a new unknown for us as well?
Right. No, it's a lot to juggle and a lot of changing pieces. Thank you so much, Sarah, for sharing. That's great information to have. And we are going to, I think I can stop. I'm going to remove your spotlight.
Thank you, Karen.
I know people love the spotlight. And I'm going to transition to Julie from there she is, the YMCA of Greenville. Hi, Julie. Great to see you. Sorry, I'm going to throw you on the spotlight so people can see you there. And same thing. So how are you doing? How are you doing during this time? How are you taking care of your mental health?
This time has been an extreme adrenaline rush. And I think, like Sarah said, there's waves that kind of come. You're working, and sometimes your body is telling you you're tired, and just learning how to listen to those cues of as we're taking care and we're helpers of everybody else in our community, how do we help ourselves? So that has been an interesting and unique journey to facilitate. But like probably many of us within the Y, I have really dug deep into my workout routine, and early mornings have been the key before the kids get up, before all the mayhem. So 5 a.m. workouts has been an amazing journey for me to kind of reset and start that day.
Thank you, Julie. Unmuted. Can you hear me now? Sorry about that.
I can hear you now. Yeah, thank you.
We're getting through it all. To do that. So kind of, same kind of question, talk a little bit about the, all the great work you're doing there in Greenville. And then, how have things been? Have you been able to stay open or transition, or, kind of where are you in terms of your programming?
Yes, so we're in Greenville, South Carolina, and we have a program here called Recess, and it focuses on adults with diverse abilities. Like Karen had mentioned, this is one of the first programs along with our active older adult programs that closed first before our actual branches closed. So one of our most vulnerable populations, some of them self-selected out due to their doctors recommending that they, quarantine and develop those practices to keep safe. It's also one of the last programs for us to actually reopen in person. So we closed in March and in-person programming began in September. So we had about 6 months of a gap of services while also having our furloughed director over this program. She was off for 6 weeks. So when she came back, we really started some virtual, there was no program, it was just more connection, social connection virtually. And as we started really looking at our community, and that's where we really first started is, our program is not the only program focused on adults with diverse abilities, and seeing what everybody else was going through and collectively having those conversations as community leaders in this area, saying, what are your national strategies? What are some things that in your guidelines that you have to follow? And so we had conversations with our adult daycare centers, and we also had conversations with Special Olympics and a community coalition called GREENVILLE CAN that focuses on recreational programs, to collectively really start having this conversation, not as one organization, but how do we really truly serve this population during this time when all of our resources are limited and access it sometimes not possible. And so those conversations really helped seeded what our new morphing of our program would be. We knew that we could not launch our program how we left it, and that was really hard and difficult. We also, within our research stage, we surveyed our parents to see what that comfort level is. And like Sarah mentioned, the excitement was there, but for us, it didn't necessarily translate into the full scope of, I would like to participate, or I feel comfortable to participate. So that was interesting for us to navigate, is how do we change our model? How do we now break even, where before this program was a mission program, and it always will be, but our Y wasn't able to carry us financially as much anymore as it was in the past. And then also with limited grants or funding not necessarily being as available as they were in the past. Mm-hmm. So that model changed completely from staff who could not allow volunteers from state guidelines into our programs. And we weren't even allowed to be in our YMCAs because our YMCAs were now virtual e-learning all-day care centers. And so there was not space with all of the guidelines. And so we, as I mentioned, took a big community approach and were able to secure a church that gave us facility rental space for free as a mission, because churches are, if you have not engaged with your churches, they are looking for ministry and how to support their communities. And we were very fortunate to form a brand new partnership just through a connection to be able to host that. So our model has adjusted. We have one in-day person programming, and we're able to provide that 2 days a week. And so we are rotating participants through. We have about, out of our 70 participants, about 48 that are attending in person. And then on Fridays, we have a virtual wellness piece. And as we're looking into the future, we're really trying to figure out how do we add on to those programs? How do we make it a sustainable program. I think that's really the language that our leadership is saying is we want this program more than anything, but how do we make it work where we're meeting all cylinders, where we're meeting the needs of this population, where we're truly making meaningful impact. We're also being responsible fiscally to make sure that we can sustain this program so we can continue to grow and invest as we move forward. And so that is really where we're at within YMCA Greenville and the diverse abilities population.
Wow, thank you so much, Julie. You know, and I really like the way that you ended that. Is kind of how do we look at this as an opportunity to reimagine how we either fund or run or organizationally position some of these programs. We know many of these communities, the need is still there, and we want to do that. But this may be, while you know we. Recognizing, right, funding is challenging right across the board. Funding streams have changed. There may be new opportunities, but how do we begin to kind of re-looking at how we fund these, how we position them within the Y, as we begin to look at equity, right, and understanding our systems, where do they fall? How are we balancing them? And then also, who are some partners? You know, I think that's another big piece is, you know, this is a time to come together and see if there's partners to continue through this. So same question again, and you named a couple of them, but any big challenges or barriers you see either now or coming down the line?
Yeah, so financially it is a big barrier. So we're also looking at, you know, also what we charge for our programs. We're looking at, is this church going to allow us to continue to have space? So space can be a potential barrier as well. Also, our staff could be a potential barrier where we had to completely reshift our model. That means positions changed. We could, you know, lose staff that are very specialized. We pride ourselves in hiring staff that really know how to serve and have the education and experience to serve this population. So that could be a potential barrier as well too, as our models shift and maybe as hours or programming is not as robust as it was. You know, how long will those staff hold on to continue to serve in those capacities? So those are some big barriers that we're anticipating going into 2021.
Great. Thank you so much, Julie, for sharing. Thanks. It's great seeing you.
Thanks for having me.
I will take you off of the spotlight and we're going to switch over to Nicole. Nicole, if you want to come off mute and I will find you. I see you. Hi, Nicole.
Hi.
Great to see you.
Thank you.
And some people I have seen, but Nicole, I have not seen since the pandemic. But, you know, same question to you. How are you? How are you doing? And how are you taking care of yourself?
Personally, I think I'm doing well. You know, trying to maintain a work-life balance. In New Jersey, our facility didn't open until late January, July, early August. So was home a lot and doing a lot of working from home. I also have a kindergartner that's remote learning right now too. So that's also helping keep me busy on a different way. So I think we're doing well. A lot of the staff, we did a lot of check-ins during our closure and periods, you know, just trying to check in on them, see how they're doing and where they're at. So I think we're doing well now. We're back into a flow. So
great. And you know, same question to you. Do you want to talk about some of the work you've been doing around supporting communities of diverse abilities and how they've fared? Again, I know New Jersey has been closed. You know, during the closed time, were you able to connect, or you know, just talk through that a little bit?
Sure. So just our program is our Score and Soar program, which is our special kids organized recreation and also special organized adult. Specifically, I deal with diverse ability swimming. So I've dealt with a lot of our swim parents through emails. Our staff were doing videos to them to try to check in. Our Y itself has done virtual classes, fitness classes for them to try to keep them engaged with our membership base and that. Swimming specifically, we just started we did a session from the spring that some of the parents opted to, you know, start lessons again and get them in. So we did a small group of 30 and we had some of our diverse ability swim participants in that, and seems to be going well. We're about 4 weeks in, we have 2 more weeks, and then we're going to be adding some more classes beginning November, December, based on what we can offer with our space. So trying to get back to a normal. It was very difficult during the closure to try to stay engaged, and I know a lot of the parents that I have talked to had some worries coming back, but also realized that their children need that programming and that socialization to what we can offer. So
right. I think, and I think we're beginning to hear a lot of that really that there's a huge need for social interaction, right? And that's what a lot of families are looking for. And how do we provide that when it's, virtually, right, can be absolutely challenging. And now as we come back, ensuring that we're creating safe spaces, but glad to hear your swim program's up and moving. What, for you, for some challenges, what are some challenges you see?
Some of our biggest challenges, I know, non-swimming wise, are definitely our land-based programs have our space. So right now we're doing remote learning for our school district. So we have kids, we have student-centered facility in 2 of our programs, bigger programming spaces, excuse me. And then our gym itself, some of the equipment was moved into 2 of the other program areas. So we've lost a good portion of our areas that were utilized for the sports classes. And I mean, we offered bowling and basketball and there was dance and Zumba. So they were doing strength training as well. So we've lost a lot of our program space, and at least for land-based, that's where the challenge is. For swimming itself, we only have a 6-lane pool. So we are running still our pool on a reservation basis. So we try to run the swim programs along with that. So they come in when the lap swimmers also are coming in, and just that space, because it's a hard balance to take a lane away from our members, as well as we want to be able to provide those lessons that are so important for them. I think some of the challenges that I've had with my staff are they themselves being comfortable getting back into the pool. It's being, they were out since March. We closed in March 15th, and didn't reopen until September. So that's been a big adjustment. And with the cases going back up, having those conversations of, are you still comfortable to continue and get in? So we're looking at trying to get more parent participation with our lessons, especially with the diverse, and trying to get them to also feel comfortable to get in and follow our policy. So I think on both sides, we want to make sure everyone feels safe, and get what the skills.
Yeah. Thank you so much, Nicole, for
problem.
sharing and coming on with us today. And our next person's going to share is Jean from the YMCA of the North Shore. Let's see if we have Jean. Jean, it looks like you're on mute. I'm going to see if I can
hear me.
Yes.
Okay.
You do have a little bit of an echo. Are you on too? Yeah.
There we go.
Thank you. So hi, Jean. Thanks so much for being with us today. And also wanted to ask, how are you? How are you doing during this time? And what are you doing to take care of yourself?
I have been doing pretty well, stayed really busy through all of this. My role as the Director of Inclusion covers a lot of our education program. And so with shutting down childcare and then starting emergency childcare very quickly after that, we have kept very busy in terms of not only supporting families as they came into emergency care, which were all brand new children in some cases, because it was all first responders, and making sure those children were doing okay coming into new environments, protecting our staff. We actually worked with a local licensed social work agency that did some trainings for us on mental health support for both staff, and then as we welcomed children into childcare. And that was largely around secondary trauma and what COVID has done to all of us, around all of us going through secondary trauma as a result of just living through this. So that kind of helped us a little bit. And so I just sort of started full bore on how do I support everybody, and just stayed very busy through that. Luckily, we have, I have a team of inclusion specialists that work within these programs that continue to support a lot of the children that were in our emergency care through remote learning for our school age children, and then just with our little guys in our early learning program. And that all went well. I had a couple of people that had to work from home, but then we as an organization really took all of our departments and did a lot of project-based work together across all 7 of the Ys, so that, and with reimagining how we could reopen our programs once we could, and how we could serve everyone better during that time. So I also worked with the gymnastics department to create a roadmap on diverse abilities in gymnastics, so that we took that idea that we did with diverse abilities in aquatics and really worked on what we could do to create a situation where we could extend our inclusion model into gymnastics a little bit more than what we had been doing. So that, that work kept us really busy through the shutdown period. In Massachusetts, our Ys are now open, as you know. And so what our real focus is right now is is really in the areas of membership, recreation, and then that childcare, education pods, and prior to that, camp. So those have been the major focus. And luckily, again, I have this team of folks that can support the work that we're trying to do to support everywhere around this. So with family membership, we really started with upping our benefits around family membership and offering free afternoons 2 days a week where parents could bring their child. Again, COVID restrictions, health attestation, numbers, masks, everything, but the children can come on a Tuesday, Thursday for a few hours free of charge without their parent and engage in activities with our camp staff. And so it's very much camp fun, and parents are really enjoying it. And what's nice too is the children, it's after their remote learning, so they can get out of their homes, come to the Y, get some socialization with some friends. And we're doing a lot of this outside at our outdoor camp locations, which has been nice, but we are coming inside a little bit as the weather is changing. We're also doing something called Weekend at the Ys at some of our camp locations where, again, parents can bring their child for these activities. In all of these programs, I had done a lot of training for camp around diverse abilities. So all of our staff have good knowledge of how to support a child with a diverse ability, or if we have a child that is on a behavior plan, we already have those plans in place. We might have a child with a diverse ability around ADHD or high functioning autism, and they're able to come into our education pods, and those children, we have behavior intervention plans for them so that all their accommodations are being met. We also have a child with a physical disability with CP, and so we have all of his accommodations in place, and he's accessing the program. He's 4 years old, and he's accessing his program with his wheelchair and masks and social distancing in the classroom like all of his other little buddies. So that's childcare really has not missed a beat, and it's really what's carrying our association right now. As I mentioned, the education pods, we are running education pods in 7 Ys across the association. And it's same as Nicole, some of our Ys, it's taking up our whole gym spaces, but largely most of them are being run out of, some of them are able to access schools, which is great, which is kind of unheard of in most of them, just maybe 1 or 2 are in schools. we have some off-site locations that we've been able to run the program. So we're serving a lot of children. We have a lot of waiting lists, and we're really struggling getting staff to come and work in these programs. That's really been the hardest part. And then also with the recreation piece, sorry, I'm bouncing around a little bit. We have actually written for a grant through the Doug Flutie Jr. Foundation for Autism, and they're doing signature grants right now. And we were able to get a letter of intent into them, and we're chosen to do the full grant application. And what that's going to provide is more recreation access for children in our communities through the Doug Flutie Foundation helping us to offset some of the costs. So we're going to, as our Y Association, for 50 families of children with autism, we're going to give them a free family membership for the year. Wow. We're going to give them access to a signature recreation class for that year, whether it's swim, water-wise, diverse abilities and aquatics, or recreation through gymnastics or sports, whatever their choice is. And then I'm creating with that grant money social pods too, so that we're getting peers together and we have coverage so that children that might be need a little more support during that social pod time. It either can be parent comes with them, or we're going to have some more staff that will be available to really open up more social opportunities for these guys. Because as you guys were all talking about right now, I'm finding that parents in our communities are really struggling with keeping their children socially connected to others. Not only have they lost services, because many of our kids with IEPs have lost services, and many children aren't even in person in a lot of cases with very involved disabilities, and then socially too. It's just been very hard for them. So the other piece around the grant is we're also building out sensory bags. And so those will be available at all of our Ys. So any parent coming in to access the Y for an event, or just to come in and have their child join a program, they'll be able to get a sensory bag from the front desk and have fidgets and feelings cards and noise canceling headphones and things like that. So their child with autism can then function a little bit better if they need some support with some of those tools with them. So that's exciting to hopefully get from that grant if we are awarded that grant. So that's some of the financial pieces. I'm trying to still secure some money to get these programs, keep these programs going, and to continue to start new things. We have some money from the state of Massachusetts in a mental health grant, and that's helping me to keep my inclusion specialists employed to support all of the children in early learning, the education pods, and then in camp this past summer. And that's giving me access to some sensory materials, and then also obviously for the time of 6 inclusion specialists to be employed across the 7 Ys. The other thing, of course, in early learning is following all the COVID health attestations, all of that, keeping kids of cohorts of 10, no moving teachers in between. So that's been a real challenge, obviously, for our early learning and education pod programs to be able to staff those to the limit that we need to the level that we need to. We're also really struggling, and luckily I have these folks to work with me on this, but children with IEPs, EI or IEPs. EI in early learning, we moved to sort of a Zoom model with children getting their EI with their teacher in their little early learning classroom through a Zoom, where the specialists can observe the children and then coach the teachers to do more of the hands-on EI work that they would have done if they're able to come into the center. So that's happening. And then we're also liaisoning with the school system a lot around the IEPs and making sure that the children, we're building out accommodations within the education pods for the children. There definitely is kids right now that we can't serve that need one-on-ones. We can't get them. Number one, we can't get enough one-on-ones to be able to come in. And with what's happening with the school systems, it's really dicey right now for children that need a one-on-one in our programs. But most of our children with IEPs are able to stay right within our education pods and are doing okay with virtual learning. It's been hard. like 2 days a week now. Some of the school systems, we're like in 9 communities. So they might be like 3 or 4 out of those 9 where we're doing a hybrid model, where others are fully remote because of COVID numbers in these communities. So that's been a little hard, but we've been continuing on with the parent meetings and making sure that we're supporting kids like we always have through the work. And then also with childcare, we've really continued to work through the pyramid model, and which is the challenging behavior website, which we're collecting a lot of data on children, whether they have a diverse ability or a behavior issue. So the data that we're continuing to collect has really helped us to determine what time of day a child might be struggling, why, what activity was going on, who was involved. We're collecting all the data using their behavior intervention data collection model that we've actually created a Google document to be able to use that through a Google document. And so with that, we have a lot of really great data to then create plans to then really make headway. And then that data is used to send to school systems, to send to pediatricians if we're trying to do referrals. And it's also helping the work that we're doing to support children. And what I'm finding is that data collection and us being able to really pinpoint what we're doing, whether we're triggering that child, whether our environment is triggering that child, or staff need more training, or the child just needs more support at a particular time of day. Because we have that, we're now building out really substantial behavior intervention plans, and we're really able to keep these children engaged and included in our programs as a result of it. So I can't say enough about the pyramid model and what pieces of that can do for your Y programs. And then also the collaborative proactive solutions, which is another amazing CPD. CPS is a really amazing organization that helps children to stay engaged in early learning camp and after school programs. So that's another really great program that we're using too in that area.
Thank you so much, Jean. That was a lot of great information. And just so you know, we've had a lot of great information coming from, and we will have follow-up for this. I know we never have enough time. I did want to call Rebecca from Fort Wayne is with us today too. So wanted to just have her share quickly as well. And then we'll talk about, our intent. Why are we doing this? Why are we sharing? Hopefully you weren't coming here because we're going to give you all the answers, right? We are working together to organize to how do we move forward and best support and lean on each other to identify some answers to help support us through these times. So Rebecca, how are you doing? Let us know about the programs you're doing in Fort Wayne, and go ahead.
Perfect, thanks. So yeah, I'm doing pretty well overall. I know that's kind of similar to what some people have mentioned. There's some, better days than others. And as numbers are starting to increase, it does cause just a little bit of anxiety with the unknown of what that looks like. But overall, we've been doing well, and we've been able to plug ahead with our adaptive and inclusive programs. So we were closed for about 2 months, a little over 2 months. So shorter than some other Ys. While we were home, obviously it's difficult to plan when you're unable to meet, and maybe program the typical way, but we did offer some different virtual options and just tried to kind of pre-plan for when we were going to be back in person. And during the summer, we were very blessed. We actually ran some really strong programs from the summer into early fall. I think a huge benefit that I've mentioned is that a lot of those programs were able to be outside. So we had an adaptive baseball program partnership, and we had more kids than we've ever had. We did have an adaptive day camp that was primarily inside, and I was surprised. That was in July, and we ended up having 15 kids attend camp. So it does, it did take extra planning of, sanitizing everything and thinking through each, sport and what things could we feasibly do so that it would be safe. But we were very grateful. Everyone abided by all the social distancing and, wearing masks and sanitizing. We had wonderful volunteers who helped wipe everything down. So we were very grateful to be able to run some of those programs. We have an outdoor bike program So just wiping the bike down after each, visitor, wearing masks or socially distancing. So all those different things. So we were able to really provide some good programs, I think, and especially when families really needed it the most. I felt really thankful that we were able to step up. And as our association as a whole, helping with, emergency childcare and food programs and things like that. So I am really, proud to work for the Y and just to see the way that they've stepped up in innovative, in maybe unique ways that we weren't expecting.
Mm-hmm.
As we look toward the fall, it is a little bit different. I know you're talking about challenges, and we did just start an adaptive cooking class. That's been a dream of mine for a while, and we had a good number register, one virtually and the rest in person. So that was great. But then we just had to cancel like an adaptive basketball class that was new. And so I'm wondering if with the numbers changing and with, programs moving more to being inside, if, I'm not sure what these next few months will look like.
Mm-hmm.
With our programs, we are also reapplying for a grant. So I know that was mentioned too, just kind of the funding. And as we really started to look at, our programs, a lot of our adaptive programs were barely, making, scratching the surface of breaking even, if that. So it's really, mission work. So it really is helping or, kind of forcing us to look at the model and the way that we do things. And so that may change a little bit as well. And then staffing just being a huge, like being, we're short staffed. And so there's been even some dreams of different things that we want to try, but just really trying to be, we're limited with the staff that we do have. And so just trying to really, we have to think a little bit differently about that too. It was interesting. I know swim was mentioned, but we have not returned to adaptive swim lessons at all. So that's one thing that we haven't done. And we just started an adaptive swim team last year. And we've had a lot of people reach out about it, but because we're through Special Olympics and they haven't started back up, then we're unable to start back up too. So there's just some of it that you're just kind of waiting, for somebody else to make the call. Like we're unable to do that. And then some of it that we've moved forward. And I am, thankful for the families who have, chosen to attend. And I think I know that was said too, but it does seem like there are quite a few families who are really seeking opportunities for their kids to be involved and to come out, and they're really abiding by all of the, safety precautions. So that's been wonderful. But also unsure of what these next few months will look like. If, we'll see as programs move to be more inside, see how that plays out. We're also, it has kind of had us think more about virtual programs though, which is not a bad thing at any point, because if someone's unable to attend, due to an injury or just another commitment, or they want to, look it up later, it's really nice for us to be able to have these options via Zoom or record them and then be able to share them. So I think there have been some positives too. And just, sometimes it can be good to, look at your programs again and really see what's working and what have we been trying to make work that maybe we should just let go. Maybe that's not the community need. And so I really do think that in a way there have been some positives, the virtual options and things like that. So yeah, just trying to stay positive, continue to offer a variety of options for families, whether virtual or in person, and just hoping for the best for the future.
Thank you so much, Rebecca. And thank you so much to our panelists who came today to share what they were doing in their communities. I know many of you are also doing great things. I see a lot, a couple other individuals here. I wish we had more time today, but we do not. But the reason we came here today, right, to share some of these, number one is to understand that we are a collective of YMCAs, right, facing some very similar challenges, some unique based upon our area, recognizing, some Ys were closed longer than others, but how do we come together and learn from one another? I really begin by the end to hear, how do we look at this model and how we serve communities of diverse abilities? Are there opportunities here to change it, to strengthen it? We talked a lot about funding, we talked about staffing, I heard training, and then also, how do we ensure that, all of our programs are welcoming and inclusive, that we can continue as they open to continue to be that and provide the supports embedded within that. So from here, what we're looking to do is we're going to relaunch our Diverse Abilities Working Group to continue to organize and provide supports. I know from a number of these conversations already, I'm sure people have questions. So my contact information is, I'm going to put it up next, but you can always reach out. We're going to continue. Sorry, we don't have time for Q&A. My email address, if anyone wants to reach out to me, and we will begin to organize. I know a number of you have been on the mailing list who have received emails, so we will continue that as we move forward. to really begin to have some topics. And what we're looking to do is have a couple webinars over the next, meeting about every other week, every 2 weeks, so we can hear in depth a little bit more in terms of, what all of these panelists are doing. I think Jean had a number of things, talked through that people may have, and each person, Rebecca, Sarah, everyone, what are they doing? And maybe we begin to focus some webinars around virtual programming. It sounds like as we transition back, or engagement. So again, thank you all so much for participating today. We are just at 2 o'clock. So we will continue this conversation. I hope it was helpful today. And hopefully, I'll see you again on a future webinar. Look for those invites coming soon. Thanks again.